The big picture, of course, is that public health has gotten swept up in a really difficult moment in society. It's not just public health, it's a lot of institutions that have come in for a lot of criticism and misunderstanding. And I think there are some issues within public health, but there are many issues outside public health that have led us to this place. And we have to find a way out of it, and hopefully not just public health, but society does too.
We spend a tremendous amount of time collecting the dots. We need to spend just as much time in connecting those dots. And that's what Public Health Connects is all about. My name is Dr. Umair Shah. I'm the Secretary of Health for the great state of Washington. This is Public Health Connects.
So I'm super excited about this conversation with Dr. Josh Sharfstein, who is not just a colleague, but has been a friend for so many years. Josh, thanks for joining us today. Josh, just so I'm making sure that I'm reading this correctly, you are a professor of practice in health policy and management at Johns Hopkins Bloomberg School of Public Health, and also vice dean for public health practice and community engagement as director of the Bloomberg American Health Initiative. Is that correct?
Yes, those are the 3 hats.
That's right. Was that 5 hats or 3? Okay.
Yeah, I think it can feel like a lot, but really it's working at the School of Public Health, which is a great place to be.
It is. And I remember because many years ago, you had this innovative idea. So we're going to talk a little bit about innovation.
Yeah.
We had this innovative idea to actually do car karaoke.
Yeah, let me remind you where that all came from.
Okay.
We wanted to introduce people to the concept of public health, but not through like a slideshow.
Yeah.
We wanted people to see what it was like in the world. And someone on our teaching team had the idea of rigging a car up with microphones and cameras, just like the bit Carpool Karaoke, but instead of having people sing in the car, we were going to have you drive the car around Baltimore County.
Safely.
Yes,
Safely. Yes.
Picking up people who worked in the health department in Baltimore County, talking to them about their jobs, looking out the window, talking about things, and then dropping them off and picking up another person. And we had people who worked in infectious disease, emergency preparedness, maternal child health, and I think you talked continuously for like 6 hours of recording.
I think I did, but was it the nurse who was the only person that got me to sing? Am I right?
It's possible. You'll have to.
Okay.
That course is free online. I think it's called the People and Power and Passion of Public Health, something like that.
Okay.
And it's free.
Okay.
And you can see that as well as interviews with some really great people, legends in the field of public health. And the idea is to get people to appreciate public health in a different way.
Right.
I remember at one point you were with the head of emergency preparedness for Baltimore County.
I remember this.
And he was showing you his pants, because his pants had all these different pockets and all the different things he kept in his pants to be prepared. He was over the top in terms of preparedness.
Yes.
And at that moment, a trash can blew in the middle of the road.
That's right.
You guys had to stop, and he's like, I'm taking care of this. And he just jumped right out, took care of the trash can, jumped right back in, and it was like public health in action.
Well, and I remember that, I'm going to get into the conversation, but we're already into a conversation. This is great because one of the things that was really exciting was that the thought was that if somebody picks up the trash can and they're visible, then we, if this was law enforcement or this is fire, we're like, great, look how law enforcement and fire are helping our community. And yet here's this person who otherwise people don't know, picking up the trash can. And I remember I was clapping for him. I said, go, great job. Because it's oftentimes our work is invisible. So
Right. At the end, the trash can's back on the road. Nobody knew that it blew out and got fixed. It's no longer a hazard.
That's right.
And public health did its job, but people didn't necessarily appreciate it.
Yeah, a lot of metaphors to take from that. Yeah. A lot of room for examples. Okay, so Professor, you've obviously been the commissioner for Baltimore, health secretary for Maryland, you've been the principal deputy at FDA, you've done federal, you've done state, you have local, you're now academic. what are you up to now, and how does this all fit into the Dr. Josh Sharfstein life of where you are and what you're doing and where you're going and what's happening?
Well, I'm a pediatrician,
Yeah.
and I started, my career in pediatric training, and I love taking care of kids, although I haven't been doing that as a pediatrician for a few years now. But, it's a special privilege to take care of kids when they're sick and get to know their families and watch them get better or help them through whatever they're going through. It's really an incredible thing. So I love clinical medicine.
Yeah.
I also became really interested in public health because with public health, you're thinking about not just one particular child in one family, but a whole block, a whole community, a whole city, a whole state, and you're thinking about ways that you can actually allow a lot of kids to have the future that they want and do the things that they want. And public health really appealed to me for that reason. And just like some clinicians really kind of get hooked on seeing their patients get better, like I got hooked on seeing a community get healthier, showing that we could reduce the number of babies dying before age 1 or the number of overdoses or reducing, preventable deaths from heart attacks.
Right.
It's just pretty cool to walk around your community. In my case, it was Baltimore, and say, I've contributed with a big team, with all these people rowing in the same direction, to more people living the lives that they want to live. And that's what I still do at the School of Public Health. That's what that Vice Dean for Community Engagement and Public Health Practice is, that role. It is really to help institutions out in the world make public health progress, but also help the students and faculty of the School of Public Health have the opportunity to contribute to that work.
Yeah, it's interesting you say that. I know there's also been a lot of work that Bloomberg Health Initiatives have been doing around trying to raise visibility of the work that we do. And in fact, Bloomberg was very much a part of this Invisible Shield project that PBS aired, and I believe here at APHA is going to be also a session on that. Tell me a little bit about your sort of approach to looking at that invisible shield concept. Obviously, we've seen how that's been tarnished in some ways and how we need to strengthen, but how do you see that? How does that all play out for you?
Well, I like the metaphor of the invisible shield because it is something we take for granted. We don't really spend a lot of time thinking about it. This morning I was able to go to the faucet and get clean water. I ran over here for this interview without coughing because of the air quality. We have safe medicines to take. We have safe vaccines. We're not all worried about measles, getting measles here at the conference. There's so many things that we say, well, of course not, but
we take it for granted.
Right, there's no of course not. It took a lot of work to get here. That's the field of public health, and I think this documentary really makes that case. Public health also did that using certain tools. The most, foundational one being data. Like really looking at data. What really is the story with measles, and how can we show that the vaccine works for it, And my work at the School of Public Health is in part not just saying, how do we tell the story of public health looking back, but how do we make public health relevant to the challenges of the country looking forward? And so the Bloomberg American Health Initiative is about some really modern challenges: addiction, violence, obesity, and all other kinds of food-related issues, the environment, and saying, well, how does public health contribute? And the insight isn't just the public health department does it all, but the toolkit of public health can be useful to these other sectors, to these other challenges. And we can see, for example, community organizations learning to use data effectively, police departments doing much better community engagement and actually thinking about policy and not just, the number of arrests or something like that.
Right.
And so we work with all kinds of people from all kinds of backgrounds to appreciate the toolkit, the expertise, and the value of public health for their own work.
And do you think we're making progress in how, it's a kind of a tough question. How do you think we're doing in terms of having people appreciate the work that public health is all about?
Well, on a one-on-one basis, I think it's pretty great. It's great work to do. Like you meet someone who has never thought about their issue as a public health challenge. Like we're talking to a lot of teachers about absenteeism, absenteeism, it feels like, well, you got a child's not going to school. Well, we also have an epidemic of absenteeism. We have huge rates of absenteeism past the pandemic. And you say, you can think about that as a public health problem. And they go, well, what do you mean? It's like, well, we could look at who is being absent, where do they live, what are the challenges they're facing, whether they have certain health conditions, but also whether they have certain educational, constraints. And then we can design solutions, not just one-on-one solutions, but solutions to support a community in making sure that their kids are able to go to school. And it's really helping them rethink that and seeing the bigger picture. It's kind of like what we're trying to do on violence. It's not just about sending more police on the street, it's about thinking about what the causes of violence are and how the toolkit of public health can help build safer communities separate from the traditional work of law enforcement. So I find that one-on-one work very inspiring. It's absolutely what keeps me going.
Yeah.
In our program, we give full scholarships to people from all kinds of backgrounds.
Yeah.
All the backgrounds that I've been talking about, planners, business people, police officers,
than
community
usual, yeah.
organizers, and they come to public health school and it's just super fun to work with them. Now, the big picture, of course, is that public health has gotten, I think, swept up in a really difficult moment in society. It's not just public health, it's a lot of institutions that have come in for a lot of criticism and misunderstanding. And I think there are some issues within public health, but there are many issues outside public health that have led us to this place. And we have to find a way out of it, and hopefully not just public health, but society does too.
Yeah, no, I think you're bringing up some really important areas of concern. And one of the things that I was going to ask you about, as you know, that we at our agency have really gone through a lot of transformation as well. And so we have 3 cornerstone values of equity, innovation, and engagement. I'm curious, do any of those values, I know they do, but do any of those values speak to you, or how do they speak to you when you think about equity, or you think about innovation, you think about engagement, or all 3 together?
Well, let's take one of the big challenges that not just public health is facing, but society.
Sure.
And that is the challenge of misinformation and disinformation circulating at scale.
Yeah.
Not just on one app or another app, but on every app. And
Everywhere.
Not just on public platforms, but in closed chat groups. So you can't even
Get to
post
yeah,
anything,
understand.
right? It's like 2,000 people chatting away about how, vaccines are a humongous conspiracy and, et cetera. That is a massive problem. We're not going to get there, I think, in public health, doing things the way that we were doing them when, the nature of public communication was you put out a press release and you talk to the few reporters who are covering health and they get the word out, right? When I was health commissioner, I used to write the press releases and send them out, and we'd be in all the papers and on the TV shows.
You do the work and you move on.
Yeah, and that is just not the world we live in anymore. And you can pretty much predict that a lot of things are going to stir up misinformation. You can think about that in advance. You need a communications team that's going to do things differently. You've got to be very attentive to equity because different communities are very vulnerable to falsehoods in different ways. Sure. You have to have partners in those communities that will work with you, not just as messengers for you, but as partners to tell you what they're hearing and reflect on the kinds of things that you're doing. You have to do things differently. That's innovation, and it requires a lot of engagement. I think we still live in the real world. I gave this talk earlier on artificial intelligence, and at this conference they make you say what your conflicts of interest are. Sure. At the beginning, do you have any disclosures to make? And I said I have no disclosures. And afterwards I thought I should have a disclosure. My disclosure is that I am a human being. I am not artificial intelligence. So I'm coming from this from a little bit of a biased perspective. But if people are going to get 1,000 messages in Instagram or Facebook or whatever Twitter's called, if they're going to get all that misinformation, we have to own the real world, right? They have to hear the real information from their doctors and nurses. They have to hear about it in their faith institutions. We have to be more engaged in the real world. I don't think this is part of my talk. The solution is, I've got a great idea. Just turn your health department over to bots.
Yeah, let's.
I think we have to lean into the human part of our jobs, and that's what your agenda feels like to me.
Well, it's interesting you say that because you said something earlier, which is really one of the things about this Public Health Connect series, which is we talk about, we spend so much time collecting the dots, and then we have to spend as much, if not more, time connecting those dots. And then the other piece of this is when we are really looking at transformation or the work that we do, we have to be thinking about not just the challenges, but what are those opportunities. So I know we're short on time, so I'll just ask this question in a different way, which is what gives you that hope for the next year? Let's not go 20 years from now. Let's not talk about when bots have taken over or whatever that is. Let's talk about next year. Like what when you look at next year, what gives you inspiration or hope that all of the challenges that we have, and you've talked and touched on so many of them. There's so many more. What gives you hope for next year that we're going to get to that other side, but we're going to get to that other side and be better off than where we are today?
Well, first, I appreciate you didn't ask me the 20-year question, because I'm not very good at that. I actually went to a visioning session once, and they went around the room and they say, "What's your vision for 20 years from now?" And one person said, "My vision is that all our food is locally sourced 20 years from now." So okay, not bad. The next person said, "My vision is that technology is just so fantastic that it fades into the background, and we can walk into a doctor's office and they know everything and they can do everything, and that's my vision for 20 years from now." And they kind of went around the room, and everybody was being very sincere. And they got to me, and I said, my vision is in 20 years our robot overlords are all locally sourced.
He's like would drop a mic.
I'm sorry. I apologize to all the people who are in the room, Umair. I don't know why I said that, but it's just hard for me to think 20 years in advance.
I'm glad I didn't ask. I didn't know that about you, but now I'm glad that
This may not shock you, but I was not invited back to another visioning session by this particular.
Well, we are going to invite you back to Public Health Connect, just so you know.
Okay, but to your question, next year.
Yes, next year, 2025.
I would think it would be fair to say I have a certain amount of anxiety about 2025 and how it's going to roll out.
Sure.
But in general, what gives me tremendous hope is the fact that I get to work with students at the School of Public Health. And the people that I meet are just so fantastic. And they're in our field for the right reasons. They care deeply about issues. They care deeply for other people. They are not, solipsistic wonders. You know what I mean? They are truly, humanitarians, and they see public health as a way that they can change the world for the better. And that gives me hope that public health is a way to change the world for the better. I've seen it happen in my career many times. I know you've been responsible for that in your roles. And we have to, empower young people to continue to evolve the field of public health, to improve it, but also to use it to make the world a better place.
It's so well said, because sometimes when we're around that next generation of leaders, it actually reminds us of why we're in the field as well.
That is Monday, Tuesday, Wednesday, Thursday, and Friday for me at the School of Public Health.
That is awesome. Okay, let me close with, grab this apple.
Yes.
I'm about to give it to you, however, with one caveat. We have launched recently our Be Well Washington initiative, and this is 8 million people, and we're looking at health and wellness, movement, nourishment, emotional well-being, social connection. And our tagline is, find your apple. And we're asking people from around our state, what's your apple? Like, some people say it's jazz, other people are, I'm gonna walk the dog, or they're reading, whatever it is. So I'm gonna ask you, what is your
You just picked
apple?
3 good ones.
Oh, well, but I didn't wanna.
Jazz, walking the dog, and reading, but you've taken them off the table. You're really making it a lot harder for me. You should have picked 3 that were
Astrophysics.
Yeah, astrophysics.
20 years from now.
Right, high impact aerobics, something that I would definitely not be that interested in.
So what's your apple?
I would say I love spending time with my family. Yeah. And just where we're not doing a lot of things.
I like that.
So I think that, like many of us, we all have very busy lives. and sometimes downtime is underappreciated. So for me, having a little bit of downtime, a chance to just hang out with particularly family, friends, of course, that really recharges my batteries.
I love it. Love it. Find your apple. There's your apple. Dr. Sharfstein, thank you so much for all you do. Thanks for joining us at Public Health Connects. Thanks for helping to connect those dots. And I hope you will find your apple every single day.
Thanks very much, Dr. Shaw.
Thanks for being here.